what's the intervention that you guys are looking to do and what problem you're trying to solve?
So here's what's incredible about having a generalized data interface with the brain. A lot of uncurable biology problems where maybe even the mechanisms aren't understood or we just can't address them biologically are addressable by technology. And I'll give you some examples. Our first application is for people who have lost the ability to speak because of severe loss of voluntary motor control, paralysis because of diseases like ALS or because of spinal cord injury. If you have a spinal cord injury or if you have late-stage ALS, there's currently no cure for that. You can't regrow a spinal cord. You can't regrow the neurons that used to help control your body. But the activity in your brain, in your motor cortex, is intact. And so if we put a device in your brain and record the individual neuron signals, we know that it's possible to restore speech for people who can no longer move. The same kind of device that can record your motor intention to speak can also record if you are depressed. It can record if you are in pain. Those things are fundamentally neural signals. Mood and pain are the psychological ramifications of neural activity. And if we can get to the substrate of those things, if we can record the neural activity, we can figure out how you're feeling, how you're thinking, if you have cognitive dysfunction. And the place where I see BCI going that's very exciting is that think about diabetes. Think about how diabetes was treated before you had at-home blood sugar testing. And then think about, in recent years, how much the treatment of diabetes has changed when continuous glucose monitors became available. In some sense, a glucose monitor doesn't treat diabetes, it just measures blood glucose. But as soon as you have a signal to optimize against, as soon as you have data, you can change the way that you treat the disease. You can take agency in kind of directing your own lifestyle if you are living with diabetes. And that kind of data, like, why shouldn't that be available for mental health? There's no reason, like, we could make it available using a BCI. And then imagine if you could direct the course of your mental health by having, a signal on your phone that says, hey, like, your bipolar disorder is not currently being well handled by the amount of medication that you're on. You should take more, or you need to switch medications. What if we could be reading out those kinds of biomarkers in real time? What would that mean for mental health?
I'm so happy you mentioned that because, one of the things that I think hardware and like medical devices got the biggest impact on is like mental health. And the reason why I say that is that if someone came to me and told me even like 10 years ago, hey, average people are going to not only have continuous glucose monitors, but they're going to pay cash for it, I would have thought that was crazy. But like, I ended up being one of those people because, through companies like Whoop and Apple Watch and everything, where people are starting to learn the value of having data, and that once you have something that you can measure, you can optimize against it, right? And I feel like, as crazy it sounds now, that like, oh, like an average person who doesn't have any pathologies might want to get some sort of BCI, but in the future, the thought is that, things are going to become more and more minimally invasive. And then if you have this ability to have something like that, that you can receive data ahead of time and optimize against it before it becomes a pathological condition, I think a lot of people would like that. And especially psychiatrists. I think one of the problems with psychiatry is that it's not exactly data-driven at all. It's probably, of all medicine, it's probably the one that's the most like art. But if you go to the annual psychiatry meeting, actually somebody did this one time. I saw it on X, where they asked these psychiatrists, like, how many patients have you cured? And the answer was like, all these psychiatrists were like, none. Right. And I think part of the reason why is that they don't have any data to optimize against.
Well, just look at, like, not too long ago, psychoanalysis was considered like a legitimate thing. Like, there's still people who are like Freudian and are like treating people with legit problems. I mean, the idea that you can talk to someone and then fill out a checklist or sort of intuit what the problem might be, or like consult like the DSM, like a big like fat manual, and try to guess at what what their problem might be, and then go to a list of pharmaceuticals and then choose one like from your gut. That's ridiculous, right? Like, anywhere else in biological sciences, we talk about mechanism, we talk about systems. It's not a good way to treat the most complex system in the world, the brain. And on the contrary, you can already see the direction things are going. There's a woman named Mariam Shaneki who consults with us and works at USC. And she is applying control theory to neural networks. Like, how do you perturb large numbers of neurons to control the behavior of that system? And that has direct implications for, companies like Medtronic, Boston Scientific, Abbott, that have deep brain stimulators. It can have a profound effect on brain activity, but sometimes it's hard to know what they're doing because you don't have a good data readout. But imagine if you paired something like that with a Paradromics cortical module to read out the exact neural state and downstream neural areas. Suddenly you could build a control loop, and then you could use control theory and you could use information theory to take a really informed view of controlling neural circuits. And then instead of like showing up at somebody's office and them asking you questions and you answering them and then them handing you a prescription and saying like, call me in 4 weeks, you could have a device that would in real time tell you if the drug is working for you. That's the future. I mean, the clinical science, it still needs to develop around that, but anyone who has a materialist view of the brain would say it's obvious that that's the future, because it's obvious that all of those things that we're talking about, whether it's schizophrenia, bipolar disorder, treatment-resistant depression, it has to do with neurons firing or not firing in the brain. And if you can read out whether those neurons are firing or not firing, you can tell whether it's healthy or pathological activity. And if you have the ability to influence that activity, then you have a control loop. And so even though, let's say this is, to some people, it might seem speculative, I think it's obvious.